Do not go to the Wuhan seafood market in the near future.
And 440 people are confirmed to have contracted a mysterious coronavirus as China works to stop it spreading during the Lunar New Year travel rush.
The latest news is the coronavirus infection has been confirmed, and virus classification is in progress. Please don't spread the word and ask your family and loved ones to take precautions.
Today, the greatest risk of global catastrophe doesn't look like this. Instead, it looks like this. If anything kills over 10 million people in the next few decades, it's most likely to be a highly infectious virus rather than a war. Not missiles, but microbes. Now, part of the reason for this is that we have invested a huge amount in nuclear deterrence, but we've actually invested very little in a system to stop an epidemic. We're not ready for the next epidemic. You can have a virus where people feel well enough while they're infectious that they get on a plane or they go to a market. The source of the virus could be a natural epidemic like Ebola, or it could be bioterrorism. And so there are things that would literally make things 1,000 times worse.
The predictions about the coronavirus catastrophe grow more ominous by the day. And despite the best efforts of countries like the United States in enacting emergency action plans to contain the disease, its spread continues at a worrying rate. Even the World Health Organization forecasts a world of pain. It says the virus poses a greater global threat than terrorism. What is coronavirus, COVID-19? Dr. Terrance Baker, the co-host of NABN TV Doctors in the House, explained the origin and meaning of coronavirus, COVID-19, and the likely cause of the disease, as well as the latest ongoing efforts to combat it.
We'd like to talk about coronavirus that is affecting the world, specifically COVID-19. Now, many of you have heard this term, CO standing for corona, V for virus, I for infectious, and D for disease, and 19 stands for the year 2019. So many of you have heard this term, but it's important to understand what the term means, and so when you hear it being spoken of on TV, radio, and in newspapers, you understand where that term came from. The coronavirus that currently is infecting us is believed to have started with a mutation of a virus, which is a small particle of genetic information that was living on a bat or living with bats. And so it mutated, it changed, and it changed its receptors so that it can only attach to and reproduce within the human lung cell.
Coronavirus COVID-19 symptoms include fever, dry cough, shortness of breath, headache, ache and pains, sore throat, fatigue. Running nose and sneezing are common symptoms.
It can take as few as 2 or as many as 14 days after being exposed to the novel coronavirus for the first symptom to develop. This is when it might feel like a cold or the common flu. Many patients develop fevers early on. The World Health Organization China Joint Mission saw that about 88% of people who had COVID-19 had a fever. Another study out of China showed that while only 44% of patients had a fever on admission to a hospital, 89% eventually developed one. But there have been some cases that led with gastrointestinal symptoms. Diarrhea, nausea, vomiting, and/or abdominal discomfort may appear a couple of days before respiratory symptoms. This isn't the norm, though, because COVID-19 is a respiratory disease.
How did the coronavirus, COVID-19, start? Early December 2019, some residents of Wuhan, one of the cities in China, was hit by a mysterious virus. The local doctors in Wuhan believed that the virus was from the seafood and wild animal market in Wuhan.
China closed over 20,000 wet markets. But wildlife markets like this are still operating with impunity across Asia, run by organised crime syndicates, are everything from Australian cockatoos, even blue-tongue lizards, to African meerkats, European ferrets, rare tortoises and snakes. These animals are never together in the wild and so are vulnerable to viruses carried by each other. In these terrible conditions, those viruses can pass to the humans who handle them.
Where you have animals under stress, therefore their immune system is down, and then through the handling process, including slaughter, that's when the highest risk of jumping from animal to humans would have occurred.
From touching the contaminated meat. So somewhere in that market, we believe there must have been a contaminated animal source that infected the first cluster of humans.
In 2002, a coronavirus had emerged at a very similar market in southern China. It eventually reached 29 countries and killed nearly 800 people. Now, 18 years later, this coronavirus is in at least 71 countries. And why is it happening in China? Back in the 1970s, China was falling apart. Famine had killed more than 36 million people, and the communist regime, which controlled all food production, was failing to feed its more than 900 million people. In 1978, on the verge of collapse, the regime gave up this control and allowed private farming. While large companies increasingly dominated the production of popular foods like pork and poultry, some smaller farmers turned to catching and raising wild animals as a way to sustain themselves.
At the very beginning, it was mostly peasant household backyard operation of turtles, for example. That's how wildlife farming started to get off the ground.
And since it started to feed and sustain people, the Chinese government backed it.
So it was imperative for the government to encourage people to make a living through whatever productive activities they can find themselves in. So you can lift yourself out of poverty. No matter what you are doing, that's okay.
The law also encouraged the domestication and breeding of wildlife. And with that, an industry was born. That's where the Wuhan market comes in. It's a wet market, the kind of place where live animals are slaughtered and sold for consumption.
As the numbers of cases increased, doctors in Wuhan began to share information securely on a private group. The doctors were cautious not to reveal the information to the outside, according to the Four Corners documentary.
Well before any of us knew about the coronavirus, there were people who tried to sound the alarm. So there were a group of whistleblowers who'd heard that there was this virus cluster, and they started speaking about it. Now, in particular, there was one doctor, Li Wenliang. He posted on a chat group with his former university classmates the people had been coming in with what he thought was the SARS virus.
7 SARS cases were confirmed in the Huanan seafood market. The main mode of transmission of the virus is droplet transmission at close range, or contact with respiratory secretions of patients. This can cause a special pneumonia that is evidently contagious and capable of affecting multiple organ systems. It is also called SARS. The patients were isolated in the emergency department of a hospital. Everyone, please be careful. That's scary. SARS is back.
Dr. Li and the other doctors continued to share information.
Be careful. The WeChat group of our class has been banned. The latest news is the coronavirus infection has been confirmed, and virus classification is in progress. Please don't spread the word and ask your family and loved ones to take precautions.
Do not go to the Huanan seafood market in the near future.
So when this group of doctors, I think they were university classmates from Wuhan, began sharing the information they had about a strange new virus on this sort of joint WeChat group, they were doing what you'd expect medical professions to do, to try and sort of pool information and see what was actually happening. But of course, that's a kind of dangerous thing to do in China.
They adopted the policy of concealing the truth from the public but starting to control the epidemic internally. This contradiction prevented them from properly mobilizing to deal with the spread of the epidemic.
The virus spread like wildfire as many people were infected by the virus. Hospitals overcrowded with patients. Hospital personnel were overwhelmed. Many people were forced to quarantine.
Around China, residents post scenes claiming officials are welding the doors of apartment buildings shut so people can't get out.
The city of Wuhan was locked down. Airports shut down. By the time Chinese authorities notified the World Health Organization, it was too late. Coronavirus has affected the rest of the world.
Breaking news tonight, millions of Americans ordered to shelter in place as the coronavirus pandemic spreads.
Tonight, an unprecedented shutdown, already a gut punch to workers coast to coast, from California to Illinois to New York.
Doors and the Italian military moves in under the cover of darkness. Their first job, to find a place to bury the dead after Barragano's cemetery near Milan was overwhelmed.
Coronavirus, COVID-19, has caused havoc around the world. What is the solution to coronavirus? Dr. Baker explained.
And so now that also brings us to why our public and government officials have been recommending that there's certain actions you and I can take. And one of those actions, washing our hands, keeping our distance from others, not going out into large groups and crowds, washing our clothes on a regular basis, opening our home windows and airing our homes out. These are all measures that are being taught to us in order to reduce the chance that a particle of the coronavirus lying on a surface around your home, around your place of business, out in public, gas stations, food stores, that a particle can travel home with you and then can make its way to your face and your nose and your mouth, down into your lungs, where it binds to your lung cells and begins to cause infection. Now, there's a rumor going on, or a myth going on, that somehow coronavirus is killed by certain types of weather and by warmer environments. There is no proof to substantiate, no proof to make us believe that this virus is killed by the environment that it's in. In other words, here in America, there's no reason to believe at this time that spring and summer will reduce the virus that's with us. There's no reason for those of you who are watching from Africa, South America, and around the world that any of you should believe that because you live in a warmer environment that this viral infection cannot come to you. It can. And I personally believe it will. The reason that you are seeing less of the disease in Africa is that you have had less visitors and travelers, vacationers, individuals coming from other nations like Europe, Italy, the United States, and China to visit with you for pleasure and for recreation. You've had less visitors, and therefore you have seen less disease come to your nation. Do not be misled by the fact that the disease has not yet come to you. Now is the time to begin preparing yourself and working with local and state and government officials to prepare.
With poor healthcare systems in Africa, is the continent ready to contain coronavirus if the virus hits the continent? Speaking with NABN TV, the chairman of Nigerian Physicians in the America, ANPA, New Jersey chapter said,
"This is a time for Africa as a whole to come together to address issues that pertains to pandemics now. Because, like I said, it's a global village, it's going to come, and we, if we're not careful, we fare worse out of everybody else. I mean, on the average, it is estimated that ideally 15% of your GDP, when EU came together a few years ago saying that's what should be spent on healthcare.
Yeah.
But you find that on average across Africa, it's about 6%, with Sierra Leone doing the most, actually, amount of money they spend on healthcare.
Yeah.
So, but at this stage, it is not just the government alone. There has to be, private, public partnership where individuals need to come together to source resources, put them together to achieve, the common aim of defeating, the issues of health when it comes to the coronavirus.
The chairman of Nigerian Diaspora Commission, a commission created by the Nigerian government, Honorable Abiki Dabiri Arewa, spoke to Joy Adedeji in Tampa, Florida, what the Nigerian government is doing to curb coronavirus.
What are your thoughts about coronavirus, which has fast become a very worldwide health crisis right now? How do you think Nigeria is preparing for coronavirus?
So far, so good. Nigeria is prepared for it. The way we're prepared for Ebola, we're very well prepared for coronavirus. It may not be glaring to you, but when you get to the airport and once you land, you find that you have our staff there that are actually prepared for you. So I'm very optimistic that it's not going to degenerate. I'm very optimistic that the steps taken so far are good enough. And I also hope that the world gets over this, the way we got over the issue of Ebola. And I'm very optimistic that we'll deal with it. We've dealt with it very appropriately, and I'm sure we will. And as for our students in China, we have Nigerian students in Wuhan, where that happened, they wanted some support, which I'm glad that the federal government has been able to give them. What they asked for, the exact amount of money they needed, President Buhari instructed we give it to them, and is to help them buy masks, paracetamol, food. And we have 60 students in Wuhan. Thank God nobody's affected. The money has been sent to them, and they actually wrote a letter of gratitude to Mr. President. So, and in terms of evacuation, we know that evacuation can't work at this point in time, but we're hoping that, I'm sure it looks like it's reducing in China, and I hope it reduces all over the world. As for Nigeria, particularly what has happened in Lagos, I believe we'll get over it. And somebody says maybe it's black resistance. I hope so.
We don't know yet.
We don't know.
This
yet.
coronavirus is growing.
It's growing anyway. But I'm also optimistic that a cure will be found for it soon.
In his address to the citizens of Sierra Leone, the president, retired Brigadier Dr. Julius Mada Bayo of Sierra Leone, said his administration is ready to contain coronavirus if the virus hits his country.
Over a month ago, my government began implementing a raft of measures to prevent the incidence of the coronavirus. We have implemented stringent entry port surveillance measures at our international port at Longe and 2 major land border posts at Balamoya and Gendema. We have instituted robust entry port screening, monitoring, and quarantine arrangements. I have personally assumed leadership of all preparations. We have triggered public health emergency measures. We have committed some financial resources to preparedness and public health education. We have activated the emergency contact number 117. I repeat, 117. An associated call center will process all calls to this number and act on each call and every information received accordingly.
The coronavirus outbreak is no longer a threat for Africa. It is now a reality, as more and more countries on the continent have cases. In Africa, 16 people have died from COVID-19, the respiratory illness caused by coronavirus. 6 in Egypt, 6 in Algeria, 2 in Morocco, 1 in Sudan, and 1 in Burkina Faso. In South Africa, which has 116 cases, the government has declared a state of disaster, restricting travel, closing schools, banning mass gatherings, and ordering bars to close or limit numbers to 50. Anyone breaking South Africa's coronavirus measures will be subject to a fine or even imprisonment. other African nations have been imposing similar restrictions. Lagos State, the economic hub of Nigeria, has banned gatherings of more than 50 people, and schools will close from next week. Nigeria, Africa's most populous country, which has 8 coronavirus cases, is also stopping flights from any country where there are more than 1,000 infections. Liberia, which dealt with a deadly Ebola outbreak several years ago and has 2 recorded cases of COVID-19, has stopped issuing passports to stop people traveling, and earlier this week banned entry to those from countries worst affected by the pandemic. Kenya, a deeply religious country like most on the continent, has suspended worship in some churches and mosques. The government also says it will manufacture its own hand sanitizer and distribute it for free in a bid to tackle shortages. Coronavirus COVID-19 has caused havoc around the world. NABN TV appeals to all its viewers around the world to follow the guardians of Center for Disease Control (CDC) or your local authority's directive for proper hand washing, social distancing, and self-quarantine if you have been exposed to coronavirus COVID-19. We all need to work together to curb the spread of this deadly disease known as COVID-19. Please stay safe. On behalf of our executive producers, Moses Adedeji and Joy Adedeji, my name is Brian Kamei.
NABN